It's a cars on the beats loaded. Somebody in the building. Hey. Woo! This is fantabulous. Woo! Wow. Oh. Dr. Uche, I hope you have your water. Yeah? Fantastic. Dr. Uche, I will see what the family members are saying. Good evening, Ma. This is Princess. Comfort. Comfort is dancing. Faith. Faith said, good evening, Ma. Nice step. All right. Thank you. Christabel. Christabel, how is our baby? Good evening, my amazing nurse angel. Listen, Christabel, I have a lot of people giving birth. The family members are giving birth. I need to speak to you all. Honestly, I don't know what to do. This is my Adobe. Adobe. Okay, Adobe, if you do me well, I'll dance to Adobe this evening. That's in the end. Yeah, I really love this song. Dancing is really sweet. Yes, yes, we did. Oh, Sylvia, I love Sylvia. Good evening, family. Good evening, Sylvia. And see, Chinazan is one of our professors, upcoming professor. Wow, you look beautiful, mommy. You know I love her. And kids love you also. How are my kids? Chinazan, she also gave birth. I think I've spoken to her. I did speak to her husband briefly. They know they're another grandma. anybody on Facebook, don't worry, they will soon see me. And I will read the last one. Sorry about that. Sending love. Ilausu, 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 Ilausu. Copy the link and share. Thank you. So, sweetheart, can you copy the link of this talk show? I'll send it to you and share it on your status. So they'll be watching us on Facebook. Yes, yes, I'll share it for you. So please, if you have not shared, share the link, copied. Yes. I'll send it to your WhatsApp now. I've sent it, Dr. Uche. You have the link on your WhatsApp now. If you want to put it on your status so your friends can watch, otherwise, don't worry. I know you took the link earlier on. Yes, I have shared. Thank you, Abel. Abel is the PA. Abel is my personal PA, SSS, FBI, MFI, permanent secretary, everything you can think of. He's in charge. I've shared. Thank you, Chinazam. Look at Obioma. Obioma, Nurse Angel and Dr. Uchenna Nwulu. You are looking gorgeous tonight. Thank you, Uchenna. And on that note, I want to start. Yes. How do I start? I'm so happy. Dr. Uche is here. I'm so happy. Before we start, Dr. Uche, last time we did a couple of games on the show. We did some exercises. We painted. Dr. Uche, you were not here last week. We painted a picture of old age. The family members painted a picture of old age. They painted a picture of a witch, although they said they've not seen any witch, but they did paint the picture. They also stated that dementia is not a mental health disorder, and they said that dementia is not a particular disease, which is true. Tonight, Dr. Che, you are here for the part 2. You are here for the part 2. But before we go on, if you can allow me quickly, I want the family members, I love them. I love them. I've been missing in action. But we'll catch up on Wednesday, hopefully. So, I want you guys to paint another picture for me and Dr. Uche tonight. Please, family, can you paint a picture of dementia? Please paint a picture of dementia. We will both look at it. This will enable us know where you are, your understanding, so Dr. Uche will know how to come in. Yeah, so paint a picture of dementia. Baby say, I miss you. I miss you too. Oh God, you beautiful you. Oh my God, we love you. I said, look, you guys should leave me alone. Paint a picture of the fantastic. Shinazam, she is an upcoming professor. She said a picture of dementia is vulnerable. Okay, let's see. Great work. You look like a little pit. I don't know what that is. Anita Gold is tagging her friends. Please keep tagging, keep sharing. We must get our friends, everyone to come. Okay, Nangog. She said a picture of dementia is disorder. What disorder? Anything can be a disorder. Great work. Needs understanding. Fantastic. Okay. Noted. Adobe. Princess, she's an ex-pioneer admin. She said memory loss. Fantastic. Yeah, you see, memory loss is the definition per se. Can you paint a picture of, if you saw a person living with dementia, what picture do you think you will see of the person? I have family, share. These people, they want all their friends to come. Dementia is a disorder, especially in old age. No, do not define dementia. Paint a picture like, how do they look? I want to understand your understanding of dementia. Oh, she's highlighting. a picture of dementia is jealousy. King, king. Okay, it could be. You see, because no one dementia person have the same. They have different kind of dementia. Is not witchcraft. Thank you, Chinazam. Can you paint? Okay, it allows to say inability to think well. They are all defining dementia. I thought they would put a picture like a face to dementia. Can you put a face to dementia? Looking lost. Thank you. Thank you. Thank you. Like, thank you. Face, baby, like, thank you. Old age, okay? Not necessarily, but okay. Looking lost. Fantastic, Deborah. Sylvia said they gaze at someone and are very serious while speaking to the person. Wow. Okay. Struggling with dressing. Thank you. Thank you. Confusion. Princess. Wonderful. Wonderful. Old age. Looking lost. Okay. Okay. And then looking weak, Obioma. Fantastic. Let's do the second exercise. We'll be quick. And Dr. Uche is taking notes. Number two, okay, this one is the picture of dementia. Number two, have you seen someone with dementia? You know, you've painted a picture of dementia, looking lost, confused, old age, this, whether is we agree or not. Now, the next question, have you seen someone living with dementia? And if you have, who is the person? Who have you seen living with dementia? Who have you seen living with dementia? A mind once full of memories, now foggy and unclear, thoughts and memories slipping away like grains of sand between fingers, a person lost in time, searching for a familiar face, a forgotten name, a distant place, memories fading like a sunset, leaving only shadows of what one was, a life full of purpose, now a puzzle, and what have you. Thank you. So, have you seen someone living with dementia? Yes, an old woman, my great grandmom. Wow, wow. Yes, thank you. Can you tell us who the person is? We want you, when you say yes, yes, who? Thank you very much. Mostly old people. Yes, thank you. Ezine say yes. I have my father's elder brother. He doesn't even remember all the properties he had. I introduce myself every time I meet him. Wow, wow, isn't it? Princess say yes. My late grandpa suffered. Wow. You see, this is almost common, but it's not really talked about. Hey, Owona, I love this girl. She's always representing IOM. Yes, my great grandmom. Wow. Chinazam say yes. From last week talk show, I came to understand that my mom had dementia. Wow. Wow. I want to say, please don't self-diagnose. Take her to hospital for proper diagnosis and also management of it. Adobe say, yes, my grandmother from my paternal side. You see, this dementia is at home. Obey said, my great grandma. Wow. And Ilau to say, my late grandma. Wow, this is serious. All right, we'll go to the next. We'll go to the next. And the next says, um, the next question is, have you cared? Have you cared for someone with dementia? So most of you say your great grandma, your mom, your dad, your paternal, this and that. Now, have you cared? Have you actually cared for someone with living with dementia? And if you have, how was it? How was it? How is your experience of the care? So I want to see if you have cared for someone living with dementia. Have you actually cared for them? Yes, a friend's mother. She thinks I'm someone else whenever I visit. This is another of our admin, Dr. Uche. So, have you cared for someone, yes, but she's late now. How was your experience of caring for someone with dementia? This is my sweet brother. He said, I have seen and I like staying with him. Wow. Okay, you are still answering, seeing someone. Okay, Oluwakemi is tagging people to come and watch the show. Sheryl said no. Wow. Wow. And he also said recently, I don't have anyone around me. Wow. Yes, my mom. Hey. Yes, my grandmom, I mean, still tagging. That's fantastic. Okay, so Michael, T said yes, and it is stressful. Thank you. Thank you very much. That's what I want to hear. Zika said yes, I am it is not easy at all. Thank you. Thank you very much. What she said, very problematic experience. I'm so happy you guys are honest. What they are saying is exactly what it is. Khadija said, yes, my dad. He denied knowing me totally. Wow. How was the experience, Khadija? Wow. This is, and it's true. Anita said, I stayed with her for years before she passed on. It wasn't easy at all. I had to introduce things over and over again. Wow. Wow. Oh, yeah, I've read this one. Princess said, yes, my grandma. Wow. Fudge said, Nosenjo, I miss you a lot. This girl is my super number one lover. She loves me like hell. Look at Fresh Sonny. Fresh Sonny, I miss you too, Fudge. Fresh Sonny said highlight. Thank you. So, yes, my mom-in-law. How was the experience? My dad, he denied knowing me totally. It was so stressful. Wow. Afrirego said, my wife, I don't understand. Afrirego, I think you have, I don't know what this is. My wife died few years ago. Most times, he kept asking me to tell his kids to let him go and see his wife. Afrirego, I think there's a typo here. I think there's a typo. Yes, I cared for my mom till she passed away. Thank you. Let's go to the last question. Okay, this is the second to the last question. Say, what is dementia? Now, I don't want you guys to go to the internet and copy the definition. Let's know what you think is dementia in your own understanding, in your own words. What is dementia? I'll read a couple. Let me know what you understand as dementia. Our doctor, Dr. Uche, is here to talk to you guys about everything concerning dementia. So, what do you understand dementia to be? According to Khadija, in last week's talk show on dementia, she said her dad is above 100, so it's very possible for him not to recognize you and deny you, Khadija. Sorry about that. Okay. Gobrem said, yes, my grandmom. So what is dementia? This Chijoke, our pioneer admin, so super active. Keep tagging, sharing, 5,000 comments. Yes. So what is it? She said, loss of memory. Yes. Fantastic. It could be, yeah. It is actually. Dementia is not witchcraft. Thank you very much. What is dementia? Beautiful Dr. Uche, I see you. Yes, and that's a pioneer admin. Ezine said, loss of memory. Fantastic. She said, Texas. Keep sharing. So, what is dementia? Dementia is a memory loss, especially in old age. Okay, dementia is having a little bit of loss of memory. She says a little bit, thank God, and also forgetfulness. That's Modupe. Modupe again, Comfort said, dementia is when our old people can't think straight or behave like small children. I'm happy because we are learning. Your understanding of dementia is great. So Zika said dementia is loss of memory, and Sylvia said dementia is a general term for a decline in mental ability severe enough to interfere with daily activity. Wonderman. Sylvia, I guess you got this from the internet. Okay, last and the least. Do you think there is enough awareness, family? Do you think there is enough awareness and sensitization for dementia? I asked this question because someone last week was saying she has never heard about the terminology called dementia before. So, do you think there is enough awareness? Khadija said no. Afri Rego said mental AI is the dementia. Khadija said no. Ilausu said no. No much awareness. Epe says symptoms that affect thinking and memory loss. So yeah, no, there is not. Okay. Princess Ozioma, Pioneer Admin, I am still going to talk to you, Princess. She said no, not at all. Fantastic. And Sylvia said no, there is no enough awareness for dementia. That is true. When say is a symptom, okay, she's defining dementia. Fred Sonny said no. Yes. On that note, I think we are going to start. So quickly, family, you see, I want to keep repeating this. I know I'm going, Dr. Uche, just a minute. Let me talk to the family a minute, then I hand over the banner to you. I said this last week, and I want to say it again. According to World Health Organization, over 55 million people live with dementia, and currently, every 3 seconds, someone develop dementia. It's weird. I want to keep saying this to you so you will get the gist. Every 3 seconds, someone in the world develop dementia. Family, let's count. 1, 2, 3. Someone just developed dementia if we are going to go by World Health Organization projection. And they said in 2015, we will have over 150 million people living with dementia. This will triple the figure we have, which is over 55 million right now. Family, I want to say to you, dementia is a global emergency. It's not just in Nigeria, in Africa, Ghana, or Cameroon, or South Africa. No, dementia is a global emergency. It is a fast-rising global pandemic, although it's not infectious. It's not infectious like they say pandemic is, but it's fast rising globally, and it is definitely a public health priority. That is why we need a lot of sensitization of dementia. However, aren't we lucky that we have in our midst Dr. Uchenna Nwolu, and she loves to be called Dr. Uche, with 8 years experience in psychiatry. She has attained Bachelor of Medicine and Bachelor of Surgery. She's currently a doctor here in the United Kingdom. Please, can you welcome Dr. Uche? Please, yes. They said, really? Exactly. Wow. Yes, wisdom is loving you, Dr. Uche. And Sylvia is clapping for you. Nangok said, Dr. Uche is looking stunning. She's so pretty, you won't believe it. You're welcome, Dr. Mrs. Who told you she's Mrs.? Yes, she's Mrs., by the way. This Fresh Sonny, he does not miss in our mind touch. I've not seen Treasure. Where is Treasure? Tamino Boma said, thank you, Nurse Angel. for the awareness you're giving to us. Thank you, Temnoboma. Chinazam is welcoming you. Welcome, Dr. Uche. She told me she's going to make a pledge to you guys. A lot of them are welcoming you. Welcome, Ma. We love you. Oh, look at Sylvia. Lucia. That's amazing. Nice to see you, Doc. They are all welcoming you. Welcome, Doc. This blessing. Wow. Welcome, Dr. Uche. And Anna Akowa Aka here. So he said he's clapping or something. She's very stunning. Yes. Thank you very much for the welcome. And tonight, Dr. Uche will look at some of your questions. What is dementia? Causes, signs and symptoms, high risk factors, prevention treatment, care and carer stress. However, I want to say to you guys, she may not necessarily completely talk about all of them. I told her before she came up, we will treat this little by little. This is a very important topic. I don't want us to jump into it and round up quickly. If it's 1 hour, we'll close. But let us start with simplicity. Dr. Uche, do you want to welcome the family members?
Thank you very much, everyone. Thank you. I'm really happy and I'm glad I'm here today. My name is Dr. Uche Nuhulu. As Angel has said, Uchena. Okay. In our mind, always in our mind. Okay.
See,
so
Dr. Uche is already a member. Lucia say, wow, sweet voice. She has a very sweet voice. You're correct. All right, Dr. Uche, can we quickly dive into dementia? Last week,
okay.
we are looking more at the experiences of our older adults,
Yeah.
um, especially due to lack of understanding of something called dementia or any other illnesses they may be facing.
Yeah.
Tonight, we want to talk about dementia. Can you, in a layman's language, define or talk to
Dementia.
dementia?
Okay.
Yeah.
So basically, I was reading the messages from the audience as well. Most of them got the definition, which actually made me very happy. That means the awareness is being created. People are aware of what's happening, which is really important. Okay. So dementia, I would say, is actually an umbrella term for a
Correct.
range of progressive diseases
Correct.
affecting the brain. So dementia, when you talk about dementia, we're talking about the brain. Once it affects the brain, that's dementia. There was an intelligent girl that defined it very well, and I was really impressed. Dementia is the impaired ability to think, to remember, and to make certain decisions that might affect or that interferes with your everyday activity. To think, remember, and make decisions. So when you talk about making decisions in dementia, you see that most times they lack capacity. They lack capacity. What do I mean by they lack capacity? They're not able to make decisions. Do you understand? So dementia affects the brain. It affects a lot. Once it affects the brain, it's affecting your whole activity, everything, your ability to think, your ability to perform well, your ability to make decision. It just seems like the whole world is over.
Fantastic. Fantastic. You know, I'm so happy because you've said and explained it so deeply that I don't even know how to tell you to explain further. So you just said that dementia is an umbrella terminology, and I hope they understand what you're talking about. So dementia is last week they said it's not just a disease. You will say, oh, this is dementia. You said it's an umbrella terminology. that a whole lot of spectrum or collection of diseases make up
Yeah.
dementia. Thank you
Yeah.
very much. And most times, we have family members asking questions. I will come back to dementia, but I remember one question we had, which we did look at, based on your definition. Um, um, I would like to bring up this question from a family member. Her name is Bukola Sunday. She's a wonderful family member. She said, is it true that when someone is getting old, you see, some people define dementia as old age. I saw someone responding to a family member of ours, Khadija, I think it's Khadija, yes, said her daddy does have dementia and he denied totally knowing her. So another family member responded and said, your daddy is over 100 years. I don't know if that is true or not. Said, therefore, they are old and they will not remember. You see, most people define dementia as old age, irrespective of the fact that we said last time that dementia is not a normal part of aging. Yes, we know old age come with it the decline in some abilities, but slow, little decline. But dementia comes with it a kind of, you see, it's progressive. Is progressive because you said already that a lot of diseases cause dementia. So this person, just like other, these are family member, just like others are asking, is it something to do with old age? Is it something to do with old age? And does it affect the brain like a child?
Okay. Thank you. That's a very smart question. Anyway, so basically, dementia is not old age. It doesn't just affect old age. We have early onset dementia. When
Correct.
I say early onset, that means it's affecting younger people. Dementia can actually affect anybody, but the thing is more common with old people. Do you
Fantastic.
understand? So I will take it again. I will redefine it again. Yes, I understand. Dementia is a decline with or in your cognitive function or brain functions. Anybody can have a decline in brain or functions. Anything can cause it. But basically, dementia is common with old people, but it doesn't mean that it would never happen to someone young. That's the thing. Okay. So there was a question you put up here that did say, can you bring up that question again? You said, is it true that when someone is getting old, their brain start acting like a child? So my dad is getting old, but he can still remember many things more than me. So it depends on individual. Do you understand? Yes, I do understand. Most times when people get old, the brain activities, everything within the brain starts to decline. I understand, but it's not for everyone. It depends on how fit you are, how healthy are you, what have you achieved in life, how happy emotionally, how how do you fit in, how would you be described? Do you understand? So that helps your memory as well. Are you happy? Because dementia and happiness goes hand in hand as well. So, because a lot of things causes dementia. So, if you're not in a good state, if you're not living a healthy life, if you're just not happy in life, yes, that's a pathway to dementia. So, it now depends. That answers your question. It depends on the state of your health, state of your mind, state of where you are. What position are you in life? What are you doing? Are you happy? Are you sad? Are you eating well? Are you feeding well? Are you healthy? That should have answered that question.
Fantastic. Just to bring up a family member to buttress your point, Ezine said that my grandma is 98 years and she remembers everything. So I want to say this, Dr. Uche. Dr. Uche, you see, she A lot of people, when they hear old age, they think of dementia, or they think of a whole lot of things. Yeah, decline, old, and what have you. Um, I want to use this opportunity to say to family members, old age, because they are talking. We are here to talk about dementia, but since they are linking it to old age and they are asking questions about old age, let me say this to you, fam. You know, there are many things we consume from birth. There are many genes, there are many biological factors, and also lifestyle. Lifestyle. For instance, a 5 to 20-year-old child can be taking a lot of sugar, doing a lot of things that can be detrimental in terms of developing diabetes, becoming very obese. But at the young age, they are able to do it. They are able to do it. But when you start getting older, a lot of lifestyle behavior you exhibited at younger age start kicking in. You see people developing diabetes, which is a killer disease. You see people having high blood pressure, which is a killer disease. You see people having high cholesterol, which is a killer disease. This does not ordinarily quickly happen at your teen age or your prime age. It starts building up at that age. You're able to run, do exercises, play, so you are, it's not exhibiting, but your choices of the things you eat is what defines you. And at an older age, it starts kicking in. When it starts kicking in, it starts affecting your memory. We'll talk a lot about high blood pressure later on, diabetes later on, high cholesterol later on. These are the killer diseases we suffer in Africa. And these are the things that even block the blood flow to the memory and causes, in many or some cases, dementia, or even other diseases that eat up the brain. Most times, like, dementia is not a normal, it's not old age. You're not like you're old, you have dementia, or people say you're demented. No. Old age, if you have a good lifestyle, some people feed on vegetables, fruits, protein, and fiber, and at old age, 100 years, they're still up and doing because of their lifestyle choices. So most times, it's not that old age means dementia, loss of memory, and what have you. It's your choice of lifestyle that affects you and start exhibiting and start affecting you when you grow old. Am I correct or not, Dr. Uche?
No, you're right. You're right. You're right. Yeah.
So, Dr. Uche, on that note, I want to ask you, because you said in your definition that dementia is an umbrella word. A lot of family members, let me see if there's anybody that I've asked, someone who is not old yet but forgetting things easily, can we term such person a dementia person, or can we say some person is at risk of dementia? Fantastic. Dr. Uche, you want to start to take this first?
Okay. Okay. So basically, that's a very intelligent question. Thanks for that question. Um, we all forget things, isn't it?
Fantastic.
I forget things. Not Angel, you forget things. We all forget things. Forgetfulness is not a crime. Okay, forgetfulness is not a big problem, I'd say. So where is the problem is when you consistently forget. Okay, every day you're forgetting things. Something happens in a minute and then you've forgotten. Recent activities you've forgotten. But you cannot say the person is demented in any way until there are more symptoms. The person displays more symptoms. You can't just say because someone has just forgotten something that the person has dementia. No, the person would have to have more than one symptoms for you to say that that person has dementia.
Fantastic. So, yeah, most times, when people define dementia, oh my God, look, my laptop will soon be alive. My enemy will soon die. Sorry. I so sorry, I just saw the signal now. Apologies. I'm fantastic. So, most times, when you hear people, they will say, this person is forgetting. Last week, when I watched the video later, I saw, oh, dementia is forgetfulness. Dementia is for Dr. Uche, you've answered it. Family. Like, I have three kids. I call one person the three names before I remember their name. People can forget things. He says someone who is not old yet but forget things easily. Can we, you see, you cannot, number one, Dr. Uche, you're a medical doctor. You should advise your family members to always seek diagnosis from a doctor. They should go to the hospital and get diagnosed. This person, we want to know more. Ilausu, are they forgetting things intermittently and they remember again? I repeat, do they forget things like, is it like a total forgetfulness that they don't remember things at all? Then we will be worried, Dr. Uche. We'll be worried if they
Yeah.
forget something and can't remember who they are,
Anymore.
where they
Yeah.
are, and they can't recall, and they
Yeah.
forgot. That is something to worry about in Laos. But if you want to tell me that they forgot where they dropped their keys, oh my
Yeah.
God, wait for me. I have
That's a
respect.
normal thing. Yeah.
I have
Yeah.
respect because I forget. If you
Yeah.
want to tell me they went to shop, did not write down a list of things to buy, then they said, I want to go and buy meat, fish, crayfish, onion, and milk. They went and forgot two things and bought two. That is normal. That, per se, you know what I mean. We do it now
Yeah.
and then. But when we need to know more, is this person forgetting everything about themselves, where they live, cannot remember? You see, that is when you now start asking questions and say you need to go to the hospital for proper diagnosis. I will
Yeah.
not, Uche said, I will not say depending because you just asked a broad question. You didn't streamline it. So depending on the nature of their forgetfulness, then you can say, oh, I think it should be looked at well, or no. Forgetfulness in it
Yeah.
is not dementia anyway, only.
Exactly. And a lot of things as well could also cause that forgetfulness in terms of real life. We have anxiety, and
Yes,
exactly, someone could be emotionally stressed and then forget as well. For an
yes.
instance, there was an exam I went into. Like before that exam, I could recite everything like a poem. I could say it. I could remember it. Everybody was like, "Oh my God, how you're going to come out in flying colors. Oh my God, please teach." I was teaching people. I went into the exam. I looked at my examiner. He asked me a question. I said, eh? He asked me that question again. I looked at him. He couldn't remember anything, any single thing till I said, hey, my enemies, oh, no, 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 no. You see this exam? I am passing you. I said,
It could be
God,
anxiety
God,
as
take control. I
well.
said, you just read this. I looked at the examiner. I coughed. I faked my cough. I started coughing, coughing, coughing. I said, I'm sorry, sir. I'm sorry. I've had this really bad cough. Thank God I'm wearing my mask. I sat down. And he said, are you okay now to talk? You know? I said, yes, I am. And by then I had said a little prayer, and that prayer gave me confidence. And I answered it. So why did I forget? Because my brain was blank. So does it mean I had dementia at that stage? No. It was anxiety.
Thank you very much. So, I think I will pin this question. There was one I saw earlier by my sweetheart Fudge. Faj said, can so what I wanted to say about the forgetfulness is forgetfulness, as Uche said and give an example, in itself is not dementia or symptom. It can be a symptom of dementia, but you can't say this person is forgetful, therefore they have dementia. No, please don't do that until they are
Yeah.
diagnosed. However,
Diagnosed. Yeah.
someone with dementia can be forgetful. It can be one of the many, many symptoms of dementia, but that does not mean if you forget something, then you have dementia. No. Thank you very much. So, Fudge said, can depression cause dementia in someone who is not yet old?
Okay. So depression is still a big term. Yeah. Depression is a problem. Depression can affect your brain. Depression can cause a lot of problem. Depression is a risk factor as well, both
Fantastic.
in young and old. That is a pathway to dementia. Okay. So depression and loneliness as well could also go together, and they are pathway to dementia. Yes, it can. Yes, it can. It can.
Yes. So, Chinazam is a very intelligent girl. Sometimes our question, she already knows the answer. She's
And
just
she's beautiful as well.
yeah, oh my God, you need to see her, and she's very stubborn. Yeah, most of them, Dr. Uche, have been asking, this person is forgetful, does it mean dementia? Which one did I see? Fudge, sorry. Fudge said, depression, can it cause dementia? This, can we now go straight in instead of waiting for them to, okay, Adobe has a question. We'll come to you, Adobe. A lot of people have been asking about causes or risk factor of dementia. So one of them said, can depression cause dementia? Can we quickly dive into the risk factor of dementia, please, so that it will get them thinking? We will also talk about the causes of dementia. But for now, let's look at risk factor. And yes, Fudge, just like Dr. Uche said, it could. However, it's not just depression on its own, and it's not just if you're depressed, you now you will get the dementia. No, it's one of the risk factors, but not the main risk factors. There are many, many, many risk factors that if you have this, your chances of getting dementia could be up to 20, 30, or 40% chances of getting dementia. Depression is in the bottom list of it. So, Dr. Tuche, can you talk to us about the high risk of dementia?
Okay, fine. Basically, there are lots of risk factors for dementia, and I'm going to say the ones I can remember, but there are
Fantastic.
lots. Yeah. So we have vascular causes. So basically, when I say vascular causes, these are like cardiovascular, like heart diseases. Okay, that can trigger dementia in a way. Okay. We also have like stroke. So anybody who has had underlying illness like cardiac issues, stroke, or any kind of physical illness that affects the brain, and that can kick up dementia. Sometimes also it's said that lack of some vitamins in the body could also cause it. Okay, depression we just mentioned is a risk factor as well. Yeah, some infections can cause it, excessive alcohol intake, poor diet, excessive sugar. Like when you keep on, even normally, when I drink a lot, fizzy drinks, I drink like 2, 3 cans a day, I tend to forget. So those are actually also like risk factor. Age is also a risk factor. Like sometimes is common with in old people. than young people. But remember, this still doesn't mean that the young does not have it. They can get it. Okay. So age is another risk factor. Brain injury, damage to the brain cells, or any accident that affects the brain can cause decline in cognitive function, decline in your brain function, reduction in whatever you're doing. You might not be able to think or reason well as well. I've talked about stroke as well.
Fantastic.
There's
Okay.
so
So,
many. There's so many, but these are the ones I can remember.
all right. Dr. Uche, you see tonight, the more we talk, the more I see where we need topics we need to talk about. High risk factors. You mentioned age. We all say age is a risk factor, is not dementia. Is risk factor, is not dementia. Dr. Uche, I think we'll have to have a serious section on old age and
Okay.
old age on itself. It's a topic we'll have to look at.
Yeah, that's fine.
Very important. Why am I saying this, Dr. Uche? Because yes, old age is number one risk factor of dementia. Why is it? Because as I told you guys earlier, a lot of cumulations of behaviors and lifestyles, a lot of intakes, diet, a lot of things we've done at young age, it starts coming back to us at older age. That is, by the way, we'll look at it as a different topic later. But Dr. Uche, tonight, you said something about vascular. I heard you say vascular risk. Um, Part of it is what we also said earlier. You see, Dr. Uche, in African countries, in Nigeria as well, we have three killer diseases. Three killer diseases. People will be like, oh my God, they were not sick and they died. Oh my God, it's Obanje, it's witchcraft. Somebody told me that when they woke up in the morning, last night, they were like breathless, as if someone pushed them, did them this. They were breathless. They nearly fainted. So when they got up in the morning, opened their door, they saw one old woman at the door. Now, as in their neighbor, this woman lives in the compound. They said that woman was the one that made me breathless. That woman was the one that nearly gave me heart attack. You see, in Nigeria and third world countries, most times people fail to go to hospital. They don't check themselves. They have a lot of diseases. They are carriers. They are able to bypass it because they are young. They no. Some people will say, "Oh my God, this person died." They said the stroke is a lie. They just the person. Why will they think like that? High risk factor of dementia. You just said vascular. I want to explain more to the I want to explain more. I'm laughing because Afri Roof said village people have dealt with us. So I want to really explain more about the vascular. You spoke about it because you know what you're talking about. Most of us don't. So let's explain it in a layman's term. High risk factors of dementia. Part of it is vascular. Part of it is protein in the blood. But let's go into vascular because our people suffer it a lot. High blood pressure. High blood pressure. High blood pressure. Family, what is your blood pressure? I want to go. Sorry, sweetheart. I have to ask this question. Family, I want to read your comments. Who knows who checked their blood pressure this week since Monday to Sunday? Who checked their blood pressure? If you did, what is your blood pressure score? Who checked their blood pressure and what is the score? I'm waiting to read. Someone is ringing the bell. Who checked their blood pressure? What is the score? I do experience high blood pressure in pregnancy. Okay. And me, what was your score? The last time I checked, it was 120/90. When you say last time, how long ago was that? 110/80. Fantastic. Some hospitals do not have the facility. Let me check who is knocking. I'll take myself out. Sorry about that. So let's still see 110/75. That's hers. Then pause is 72. Fantastic, fantastic. All right. So I'm happy. I'm happy that our family members, some of them are checking, but a lot of them are not. Trust me, because it is always overlooked. So when someone has a heart attack, has a stroke, mini stroke, what caused it? What causes it? Dr. Uche, do you want to tell us what causes vascular issues in people? Dr.
Okay.
Uche.
Okay. So basically, for vascular issues, we're talking about anything vascular, like cardiovascular issues, heart issues, So what actually causes it is most times when it happens is due to obstruction of blood flow within the vessels of the heart that is meant to circulate blood within the
Fantastic.
heart. So when this blood does not circulate, there would be limited blood within that area. Do you understand? That would lead the heart not to pump properly as it should. So this leads to any cardiovascular issue. So
So if it starts pumping, can it get to send blood to the brain?
yeah, so basically, when it happens, that's how it links to dementia. Once there's any obstruction of blood supply or cut off of blood supply anywhere in your body, it affects the brain, leading to something called vascular dementia. So basically, for vascular dementia, you would see that when you ask the patient some about the medical history, the person will tell you, I had heart failure 2 years ago. I had stroke 4 years ago. Yes, I have high blood pressure.
I have
You know,
diabetes.
I have diabetes. So there's just you know combination of both causing that problem. So what would this teach us? This should tell us that once we live a healthy life, you're saying bye bye, or you're chasing dementia away.
You've gone to the next one in terms of prevention of the high risk. But before we go there, I'll bring you back to the stage. Family. You see, most people think dementia is a mental health issue. We asked family last time, what is dementia a mental health issue? They said, yes, it is. Dementia is physical. You just heard Dr. Uche, how she explained it and some of the causes. And I'm happy some of you, they say they're learning. I'm looking at their right on. Yeah. So I want to ask you because another risk factor apart from a number, how it comes is age is number one risk factor. High blood pressure is great. Oh my God. If you have high blood pressure, oh my God, check yourself, go to the hospital. The only medication I know treatment for high blood pressure is medication. This is one illness that you need medication if you have high blood pressure to bring it down. Otherwise, it causes these vascular issues. Now, we have diabetes. Diabetes. Can you tell us, family, Have you checked your blood sugar level? Family, I'm not here to teach you and go home. This is practical. I want to engage you to also get you thinking. That is why we are here. Family, did you check, because diabetes is on the list of main cause and risk factors of dementia? So, can I ask you, family, who checked their blood sugar level this week? If you did, how many is it? I'm looking. Blood sugar. Yes, I did recent 110. That's blood pressure. Thank you. That looks good. Now, who checked their blood sugar this week? How many is it? I didn't. Thank you. Yes, I have checked. My sugar is no, I'm not. Oh, no, no, no. Family. Um, Apart from Los Angeles today, I have met another woman that is representing well, Dr. Uche. This is an admin. He just said, apart from Los Angeles, so I will sack him. He just wanted to say, Dr. Uche, you are beautiful. This my admin like women a lot. Don't mind me, he's a very faithful husband to his wife, Sarah. Sarah, where is Sarah? Where is Sarah? Sarah, Chintok. Tell Sarah I said she's not representing. I can't remember when last I checked. All right, so now, I want to say this. Diabetes is one major cause, or risk factor rather, of dementia. Diabetes is a cause of vascular dementia, which causes dementia. You know, we have causes of dementia. We'll soon get into it. But diabetes, see, sorry, I saw this one. I said, yes, Chintok, go to hell and burn to ashes. That is my Abel, my PASSI, FBI, MI5, and permanent secretary. He said, Los Angel the finest. Thank you, Joe. No wonder I can't do without you. So back to what we are saying. Diabetes. What kills people more in Nigeria? When you see someone is dead, when they say to you, oh, suddenly this person died, you ask them, what killed them? They say it's someone's hand is in it. You say, yeah, but what did the doctor say? They said they have diabetes, and they also had high blood pressure, so these are a must watch. We are asking, how do we prevent dementia? How do we stop dementia? There are many things you can do to stop dementia. There are many things, starting from your lifestyle. It's not when you grow old you have dementia. No, that is not a normal part of dementia. Old age does not signify dementia. It's your lifestyle choices. If you don't check your blood pressure, if you have high blood pressure, you must take medication. If you don't take medication, you will have a vascular issue. And if you have many strokes, small strokes, you will know. You will know you're having them. What happens? It can affect your memory. This is when a number of it will now cause dementia. Simple thing like blood pressure. If you don't check it, if you don't monitor it, you are high risk to get dementia. This is what doctor said. She said it, but because she's not talking like emphasizing it like me, it will be as Nosenja, you're talking too much. Yes, I will talk too much because your life is my priority. Your health clarity. Let me say this again. You asked here, what? Okay, I see Sarah. I'm here, ma, but you have not been reading my comments. Sarah, apologies. I love you. Sorry about that. Thank you. I'm like, where are you? Okay. So, family, risk factor of dementia. I need you all. Tax for next week. Dr. Uche is here to sponsor. Tax for next week. Go to the hospital. Check your blood. I want you to check 3 things for a start. 3 things. Check your blood sugar. Check your blood pressure. Check your cholesterol level. 3 things, because these 3 things can, Dr. Uche, these 3 things, can they cause vascular dementia, or are they risk factor of dementia? Yes or no? Okay, you shook your head, so I think it's yes. Family, for the next week, one of our competition is to see who checked these 3 things. Don't give us the hospital reading. Hospital reading. Your high blood pressure, your sugar level, and your cholesterol level. If you get it, come to the page, let us know. We'll post something and we use it as contest. The winning prize for it, Dr. Uche has pledged to do it. The winning prize is 150,000 naira. Yes. So you will do it. We'll change it into a contest. More details to follow on the page. This is serious. Hey, does it mean memory loss? Does it? Now we are telling you. Risk factor, old age, yes, because of our lifestyle. Now, another main risk factor is high blood pressure, which is called hypertension. High blood sugar, which is called diabetes. Being overweight. If you know you're overweight and obese, please start exercising. Check your intake. This is also what causes blood sugar diabetes. Check the intake of your food. Start eating good food. Eat fruits and vegetables, fiber. Eat things that will make you not to be obese. Engage in exercise. Are you a smoker? Please check yourself, not just for dementia, but also for COPD. Dr. Uche will explain more. Are you drinking too much of alcohol? You see, these are risk factors that can lead to dementia. Some people boast about drinking. Dr. Uche, some people boast about drinking. They will say, oh, I went and I drank a carton of beer. It did me nothing. They are boasting that they are drinking. Dr. Uche, these are lifestyles. Like, they're like, oh, this old man is now and sick. Memory is this one is that, because they're old. No, not just because they're old. It's their lifestyle choices, things they take in. Some of them don't do exercise at all. They lie in bed, they watch films, they play games sitting 24 hours. Your lifestyle choices make you to be at high risk of dementia. Also, like I said, physical activity. Dr. Uche said isolation. I heard you say being isolated, not engaging and using your brain. When my son asked me a question, Mommy, what should I do? A, B, C, D. I said, use your brain. He doesn't like me saying that. I said, use your brain. Stop depending on my brain. Use your brain. Work, not just do things in the house alone. Socialize with people. Remember the 3 things you will do to get into the contest. This competition is for next week. We are yet to announce the winner for the last, of course, challenge. But this competition, we may increase it as we go. But for a start, 150,000 naira. Go get your result. Come to the page. We will now decide on how to play the game. Now, Dr. Uche, we have a lot of questions. Nangog said, what are the obvious symptoms someone can see to believe that someone has dementia? Before you respond, Dr. Uche, I want to remind family members, now God, please, yes, Dr. Uche will tell you the obvious signs and symptoms. You said to believe. Before you start believing, I want you to go to the hospital to get proper diagnosis. Please let them test you. Let them run some medical check. Check your history. Check a whole lot of things. Carry out a proper check test on you. If it's vascular, they will do some physical health check. Check a whole lot of things before they tell you whether or not you have dementia. Please don't think, oh, if I see this, I see this dementia. Don't self diagnose. Don't self diagnose yourself or someone of dementia. Go for a proper check. However, Nangod, there are certain signs and symptoms that you will see someone exhibiting that you will know that this person could have dementia. Dr. Uche, do you want to tell us about that?
Okay. So basically, there are lots of signs and symptoms of dementia. The first one we know, we're talking about memory here. We're talking about, decline in brain activities and everything, brain function. So loss of memory is number one. When I say loss of memory, what do I mean? That this means this person is not able to remember things anymore. This person might not even, let's say I'm your sister, I come in and you're asking me, who are you again and what's your name? Are you are you Nena? You're not Uche. Are you Nena or Uche? You're not able to differentiate between two people anymore. You can't even recognize who the person is. And this person is meant to be someone who is really, really, really close to you and you can't remember. There's lack of concentration. Okay, you're not able to concentrate anymore. Like you can't concentrate. You're doing something, all of a sudden you leave that thing. You tend to, like, not concentrate in whatever you're doing anymore. You can't even drive. You're someone who used to, like, get into your car and drive to somewhere. Then now
Yeah.
you start driving instead of going to Uche's house. You start going to Angel's house. You can't even identify the addresses again. So not remembering recent activities. Like they ask you, what happened the other day, mommy? What happened the other day in Kichi? What happened? You're not able to remember. And this is something that was very important to you that you should be able to remember, and you just forgot it. Then another thing is people with dementia tend to have decline in personal care. You see that they lose touch with life. They lose touch with a lot of things. They tend
Go on.
Sorry, I was reading a comment. So
Okay.
they lose touch with a lot. They tend to, you call them, they don't even want to have their shower or clean up themselves or have a wash. They tend to, they start smelling. The personal care is now a problem. They don't want to do anything anymore. That's actually a symptom as well. Isolation and lack of sleep as well. They tend not to sleep well. They isolate themselves. They want to be alone. They just don't want that noise. And people with dementia tend to lose touch with food. You know,
Mhm.
like they end up not eating the way they normally eat. So you find out that most dementia patients come in, or their relatives most time bring them in because, oh, mom is not eating well, dad is not eating well anymore. That's like a frequent symptom that comes with dementia.
Fantastic, fantastic. Will I say cocastic? Dr. Uche, you're truly the best. Honestly, thank you for your explanation. But you know me, Dr. Uche, you know I like talking, and you know I like hearing my voice. But some of it is because, Dr. Uche, I want to re-emphasize and push your point deep, deep, deep. Because, people are like, I don't know what dementia is. Is forgetfulness dementia? Is it? We need to hit it deep, deep, deep. You've spoken like a doctor. Let me speak like a nurse. Because Dr. Uche, nurses are closer to the patients. You are there as a doctor doing your doctor work. We are there with the patient. attending to them now and then. So, regarding the signs and symptoms, just like Dr. Uche said, I would like to remind you, remember that the symptoms that people develop, when you have symptoms, it depends. Dr. Uche, I think your this thing is making noise. I can mute you for now. You've unmuted yourself. So, family, the symptoms you develop depends on, like what Dr. Uche said earlier, it depends on the area of the brain. Remember, dementia is an impairment, a damage to your brain vessels or cells. So when you say signs and symptoms, she read a lot of signs and symptoms, giving you examples of it. But you need to remember this. It depends on the area, because the brain is that is another thing we'll talk about. Brain is another area we will talk about, because most times there are many things we consume without thinking that there is a brain that helps us to function. Our daily activities like cook, sleep, eat, play, even to have sex, there are functions in the brain that work towards it. Therefore, depending on the area of the brain that have been affected by the disease, that have been damaged by the disease, it could even change our mood. Dr. Uche, the last time they were like, I think dementia is a mental health issue because people with dementia behave like mental health patients. Okay, that is a symptom, because, as Dr. Uche said, it damages the brain. If it damages the brain, that area of the brain that controls the mood can change as well. It's physical, but where it damages depends on the signs and symptoms you will see. Most people present differently. Dr. Uche just read out a whole lot of things. Yes, it affects the memory, but sometimes the symptoms, definitely not sometimes, it always gets worse. That is why it says it's a progressive illness. Eventually, you need to understand that people with dementia, like Dr. Uche said, we need someone to care for them. That we need someone to do, because of the declining nature. Because of the declining nature of dementia, it's a progressive nature that you decline in your daily activity. If you see someone that needs help, okay, someone that is so active before, they drive, like you said, they drive to work, they cook their meal, they write, read and write, they do normal daily activity, come back, have sex, sleep, wake up, cook, go for exercise. After a while, this person now cannot cook. They can't remember how to cook. Their daily, listen, I want you to hear me. Again, it depends on the part of the brain that was affected, because we have different areas. That will be talked of another day. But the symptom you will see, depending on where was damaged, they may lose their cognitive function. They may lose their ability to remember things, to think, to do their daily functional activity. When you tell them to go and cook, my Nurse Stacy last week, Nurse Stacy told you how the grandma boiled, what did she boil? Is it a cup in the microwave? Not boil. She put something, I think a cup or I can't remember what it is. This is a woman that used to cook. So she went to prepare dinner. She puts a kind of item, not food item at all, in the microwave, and until they started perceiving smell of smoke. Then I asked, this woman thought she was making dinner for her husband. You start losing your ability to do your regular, normal daily activity to the extent. That is why they say dementia will be dementia when it affects your daily activity. So therefore, you don't know how to prepare tea, you don't know how to cook. Me, I don't know how to cook. Oh, it's not dementia. But then, if you love to cook and know how to cook, you won't be able to cook the normal thing you can cook. You can't. You can't, because the area of your brain that is about have the ability to make decision, think, remember how to cook is gone. Some people, it affects their motor, their leg. They can't walk, even to walk upstairs. They need support. They wee and poo in their pad. Someone that used to go to toilet. This is not like this person is disabled before. They always wear pad. No, they used to go to toilet to use the toilet because they now you notice they're always and they don't even know. They don't even know they wee in their pants or they poo and they're carrying it like that, going about. This is something you will see and you will start saying something is wrong. And before that, before you see the symptoms, a lot of things have happened in their brain. Yes or no, Dr. Uche? You're muted.
You're right. Yeah, you're very right. That's true.
Yeah. So there's someone else that asked a question.
Mm.
I will ask. I saw one from Princess. Before we ask from Princess, Nangog again. She said, "Sweetheart, is dementia curable? Is dementia hereditary? Can it be managed?" She asked everything together. Is it curable or manageable? Is it hereditary? Before Dr. Uche speaks, let's allow her time. I will say, last time, some of you were saying dementia is temporal, it's permanent. Dementia is just said is an umbrella term. Dr. Uche, do you want to answer or do you want me to go on?
Yeah, that's fine. Anyone is fine. I'm happy with
Okay,
anything you choose.
respond. Then I can buttress your point. Is
Okay.
dementia curable, manageable, and hereditary?
Okay. So for dementia, dementia is not curable. You don't cure dementia, but you can actually delay the progression. Okay. So there are so many ways to delay progression. We can do it in two ways. You can use medication, and also for dementia, care is important. The way, the level of care you give to a dementia patient matters and would limit progression, reduce progression. A dementia patient needs proper proper care. You need to care for the person. You need to show love. You need to make the person understand that life is worth living. Okay? Love is important in dementia. With all this, you would delay the progression. With some medications, we tend to delay the progression, but it's not curable. Someone with dementia can never go back to who they were before. So it's not curable.
Fantastic. Dr. Uche, you always answer as a doctor, and I talk like a nurse. Not the small thing. So, Dr. Uche has said it all. She asked, is dementia hereditary? Some gene, Dr. Uche, you didn't respond to the if dementia is hereditary.
Okay. So for some, most of dementia has not been inherited by most people. There's a link. It could be genetic, but it's been said that most children, grandchildren haven't inherited dementia. So it can be hereditary, but basically, there's some families without history of dementia that you can come in and still see that there's someone there that has dementia. So it has genetic link. It can be inherited, but some people still don't inherit it.
Okay. Thank you very much, Dr. Uche. You are the doctor in the house. She said, who am I to argue? I'm only but a nurse. So, yes, we'll start from where they ask, is it curable? and is it manageable? Dr. Uche just answered, it's not. And I want to come back because last time they're like, oh, is it when how old? I think someone, I can add this question. I think someone was asking how old. Okay, that's my sweetheart. I've seen her question severally. I removed it. She said, how old can one, how, like what age can we be expecting dementia? Doctor, do you want to add this before I portray the point? Oh,
Okay, that's fine. So basically, you have early onset dementia. This is actually dementia that starts early. When I say early, before the age of 60. Most times, people with dementia, older people with dementia, it starts from 60, 65. You now see that they start displaying all those symptoms of dementia. So I would say 60. But early onset, sorry, is before that time.
fantastic. So, Adobe, no one can tell you this is the age to start dementia. No, no one can say that to you. But like Dr. Uche said, dementia, because they say old age is main risk factor for dementia. What I'll just mute because of the switching voice sound I'm hearing. Thank you. So, because they say old age is number one risk factor, people tend to start looking at the percentage of dementia to occur in people from age of 65. I think 65 is I can't remember the percentage. Then Dr. Uche, if you want to leave, do you want to go? Do you want to? Okay, fantastic. So fantastic. So it starts with, they say old age is a risk factor. Therefore, if you ask how old, they don't know. However, from the age of 65 to let's say 75, the percentage is probably 10. I don't know exactly, but it's a bit higher than under 65, as Dr. Uche said. That does not mean under 65, from any age under 65, you can't, like when I say any age, I mean under 65, which is called early onset of dementia. Some people, I think it's up to 9%, between 6 to 9%, have been seen to display dementia before the old age of 65. However, for you to, like you say, what age? There is no particular age, because if you say from 65 you get dementia, no, it's not true. However, high risk is old age, which means 65 to 75, medium risk, 75 to 85, higher risk, 85. You see, that's how you determine the risk factor of dementia, but there is no particular age you say this is dementia age. No, it depends on lifestyle again, but we'll leave it at that. So the other person was asking, is dementia curable? And oh, no, no long gist. No long gist. Is dementia curable? And oh, no. You see, when people talk about dementia, you need to first of all understand that dementia is not a particular disease you will cure. You need to understand this. Dementia is not a particular, this is disease of dementia. No, it's not. It's not one particular disease. We've not talked about the diseases or causes. Yeah, we've talked about what causes vascular dementia, what causes Alzheimer's dementia, but we've not talked about the cause of dementia, which is vascular dementia, Alzheimer's dementia, body fluid dementia, frontal lobar dementia, a lot of causes of dementia. So dementia is not one single disease you will look to cure. No, you can't. Dementia is permanent. It's only, you can only be said to have dementia if it has destroyed, damaged, cut off, blocked, removed, restricted some veins, or what do you call it? Some cells in your brain. It cuts off the blood flow. It puts some deposit proteins in terms of Alzheimer's disease, even body Lewy disease and others. It deposits proteins where it's not supposed to be in your brain. It's not one disease, it's a law, at least more than one. So when you have different causes of this dementia occurring in your brain, it causes damage. And when it cuts off, for instance, the vascular dementia or the Alzheimer's, when it starts depositing plaques and proteins in your brain where it's not supposed to be, or when it's leaking blood and a whole lot of things happening in your brain, is a permanent damage. Is a permanent damage. Dead cells don't rise when they are dead. They are dead. They are dead. They die, and they cut off the flow of the blood. You know, we talk about, why do you think I want to give away 150,000 naira? Do you think I want to give away 150,000 naira? No, I don't want to give it away, but I'm giving it away because I know that part of what cuts off the blood flow, like Dr. Uche said, is high blood pressure. When you have sometimes blood clot, Dr. Uche, yes or no? Sometimes blood clot stops the blood flow into your brain. When blood stops flowing into your brain, your cells that need the blood, depending on the particular area that was affected, get cut off, blocked, permanent, uncurable. Now, you said, can it be managed? Yes. Yes, it can be managed. Now, how do you manage it? Remember, we said, go check your blood pressure, go check your blood sugar, go check your cholesterol. If, for instance, you have a very high blood pressure and you didn't check it, and it's so high, it causes bursts and it blocks it cuts off, it doesn't supply enough blood, or it kicks out or damages, or even your blood sugar or cholesterol start causing plaques, blocking the arteries from the flow of blood. What happens? If you are not checking it, this can now affect your brain. 1 minute. This can now affect your brain. And when it affects your brain, we'll soon be rounding off. When it affects your brain, if it causes many strokes, sometimes you don't see it. People are functioning, but they have a lot of stroke. They had strokes 2 years ago. They are still functioning. Yes or no? Yeah. So now, why we say, yes, it can be managed. If it has already cut off some, and some cells die in your brain, some of the cells die, and they say you have dementia, they can't resurrect it, it's dead. However, they can stop more cells from dying. If you check your blood sugar, your high blood pressure, and if you check your cholesterol, and a lot of other activity, your diet, exercising, medication. If your blood sugar is high, you start taking medication. You're now managing the high blood pressure so that it will not cause more damage. So yes, it can be managed. You are not, it's managing the progression. You see, they say it progresses. If you don't manage it well, it progresses quick. But if you manage it, it's slow progression. So you need to go check your blood sugar, blood pressure, and cholesterol for a start. Now you say, is it hereditary? Doctor have answered. What should I say? It depends. You can have the gene, but sometimes they are still struggling. They say, yes, he said. You will see some people that their parents had it. They will not say, my great grandparents had it, my grandparents had it. It's in the gene. However, there are certain things you can still do to see how you will slow it down from affecting you. It could be hereditary, but one thing I need us to all go away with is that dementia, because it has not been the cure has not been found, is also because they are still investigating and researching. They're investigating and researching. They don't fully understand it totally. If they have, then they'll bring out a cure. They have, they're getting things, they're stopping some things. They've not really fully understood the picture. They are thinking, is it hereditary? Is it this? Is it that? So all these things are still under investigation. But the ones they have actually traced is the ones we are aware of, and those are the ones we need to manage. I will take a last question. Let's see, first of all, what the family members are saying before we take the last question. Is dementia a life-threatening case? Of course. I said to you, it's a global pandemic, not the infectious one. It's a pandemic. You know, some diseases are happening in, they'll say, this black people suffer from this, white people suffer from. But dementia is a global pandemic, not infectious pandemic type, but it is global. Every country majority is a world health emergency. It's a public health emergency. It is not just in a state. So exactly investigating, yeah, they
Yeah,
are.
because and it leads to death as well. It leads to death if
Oh,
not
oh,
managed properly.
of course, managing the disease that lead to dementia means managing dementia. You see, and Chinazam is a bookworm. Fantastic. I love tonight's teaching. And Nurse Angie, I love you. You won't kill me, Fudge. Fudge says she loves me 98%. So we have to go. But before we go, I think there is a question I want us to come to. This Dr. Uche, Princess is our ex pioneer admin. She's a fantastic girl as well. She said, I started experiencing memory loss after childbirth and it hasn't stopped. How can it be stopped and what's the medical name? Oh, you're muted. You're muted, Dr. Uche.
Okay, basically, for such situations, I know that childbirth comes with a lot of things. After childbirth, you call it postpartum. So it could be postpartum memory because I know that sometimes after birth, people tend to experience lots of things: depression, anxiety, postpartum depression. Postpartum depression can actually cause memory loss. Okay, so with such situation, when your hormone normalizes, they tend to reduce. You tend to start remembering lots of things. But with such situation, number one, my first advice would be to go to the hospital to get your mental state tested. It's called MSC. You need an MSC examination, okay, just to rule out any form of any onset dementia. That's number one. Secondly, there are lots of vitamins that would help. Like there's Jinkoyo, something called Jinkoyo. It's sold every pharmacy. Jinkoyo can actually help rebuild your memory. At this stage, I take Jinkoyo every day, every morning because it helps me, you know. So you can try Jinkoyo. You can try different types of multivitamins, vitamin A, vitamin B. They would help you. Try to exercise, try to eat healthy, and psychologically believe in yourself. Believe your memory can come back to what it used to be. that can also help. So I think it's related to postpartum, it's related to childbirth, because with childbirth, a lot comes with childbirth. After childbirth, a lot comes as well. It takes time. Another thing is, when was your childbirth? How many years has this been? Has it been ongoing? Has it been consistent? Did it come and stop, or was it continuous? Those are questions you would also need to answer so that we can lead you to the right path.
Fantastic. Fantastic. Um, um, Princess, I would say, I think I want to believe, I don't want to think for you, that you've been to the hospital. Yeah, I think it's something that to do with, like Dr. Uche said, postnatal, I don't want to say depression, after birth. But we also have something they call mom's brain. Mom's brain, when you give birth, you start forgetting things. It's called mom's brain. It happens. Some people, like Dr. Uche said as well, after childbirth, you suffer. Some people, I don't know. Princess, can you let us know if it's just memory loss of if or and you said she said and it has not stopped. What kind of memory loss? Is it short-term memory loss? You forget, you remember? Because this is very important. It's not something we'll just say this is what it is. It's always, I
Yeah.
always say to people, go to the hospital, go to
Exactly.
the
Sometimes it could also be like an underlying illness that hasn't actually been diagnosed causing this. So that means when you go to hospital, you need like a proper blood test to show for you to understand what is actually going on. You might need a brain scan as well, just to
hospital.
see if there's any problem anywhere. So my number one answer to that question would be go to the hospital. That would help.
Fantastic. So, Princess, we are here to share information that are health related. But for this particular personal question, because you just typed something short, you did not say a lot of, like you said, I experienced memory loss after childbirth. What does that mean? Did you forget you had a child? Did you forget a lot of things from the past? How long did it take?
And
Did
how
it
long
come?
has it been? Exactly.
And
When was the childbirth? How long has it been?
exactly, it
Yeah.
has not. Has it come? There are many questions and investigations that needs to be performed on you. Test, question, investigation, scans to understand. What I know, like you said, it hasn't stopped. Like the mom brain, when you're pregnant and you give birth and you forget, it is not. It is also there. It's not strange. It's a normal. It's not normal, but it happens. But you said yours haven't stopped, and you want to know what's the medical name. I think mom's brain, and also it could be postnatal as well. But go to the hospital, or you need to give us more information. However, I will advise against diagnosing you here on the platform. You need more time. We don't even have time. I just read this in 5 minutes, and we can't diagnose you in 5 minutes like the doctor. So take your time. You can call me later. Call me later. I will connect you with the doctor who asks more questions, do more investigation. You carry out more tests to be able to find out what it is. Because, like doctor said, it could be sign of something. It could be sign of an underlying, undiscovered, undiagnosed illness. So please give me a call later. Let us see how we can follow through with this. On that note, Dr. Che, we will not. We have to end. We have to stop. We can't go on. We will not finish depression, dementia.
Okay.
We cannot. We need to come back again. We need to
Okay.
do it part three, part four, part five. It is a very important topic. It affects every one of us. I just counted at the beginning. It sounds strange, but it's a fact. But World Health Organization, they do intense and intensive research. They said in 3 seconds, someone develops dementia. We have spoken for over an hour plus, over 8,000 people. If we are to go by that projection, 1, 2, 3, someone has got dementia. So dementia is a household name. It's not always, like cancer. Oh, I don't know about cancer. I don't see cancer. It's far away. You say some illnesses, people will tell you, I don't know what it is. Unless you're living in a particular area, you won't know what that illness is. But dementia is a household name. So we will come back again, family. I and Dr. Uche need to dance again. Again. We need to dance one more time to entertain you. So part of our mental health entertainment, Dr. Uche, is to dance. We dance so that family members can be happy. So I hope the music is still on. Let me see.
You understand that from me?
Fantastic. Adobe, I'm going to dance Adobe today. So let us dance and then close the show. We have to close the show.
You understand that from me? You understand that formula? You understand that formula? You understand that formula? You understand that formula?
Girl, I'm addicted to you. I don't know what to do to me. I want to give me trouble. And I'm back to the top of the road. You're beautiful. Baby, there is something about you. I want to be your man. The way you dancing, the way you shake your body, they make me go crazy. Do you know how you dancing? How you shake your body, they make me go crazy. Girl, I want you to be from here down to South Africa. You know I got the formula. I know you like the formula. You're looking for the formula. From here down to South Africa. You know I got the formula. I know you like the formula. I like the formula. Baby girl, see I love the formula. Them say every night you popular. Every lie you the best, my medulla. My medulla on the regular. I go like to give on the regular. And no man make a push you secular. That thing with the best, my medulla. My medulla, yeah. I'm not taking push on my leg. Baby girl, it's not on my brain. I'm loving you without the shade. My I'm not taking push on my head. Baby girl, it's not on my brain. I'm loving you without the shade. Oh, sweetie, I'm a sweetie, baby, love you, this is from I get, I'll be back, so far, I got my go, I'll be back, so far, I got my I don't know what to do to me. I want to give me trouble. You're beautiful. Baby, there is something about you. I want to be the way you dancing, the way you shake You know I got it formula. I know you like it formula. You're looking for the formula. From here down to South Africa. You know I got it formula. I know you like it formula.
Wow, 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 wow. Woo! Frank said, I love you all. I love you, Frank. Always in my mind. Yes. Adore Dele. Ayo Dele said, I love your stairs. Thank you. I don't know who they're talking about. Now God said, hooray. And Chinaza said, now me win this dance. You see Chinaza. So, Chidroki said, Dr. J gets got nice moves. Yeah. She's dancing. Nurse Angel rock on. Now look, before we have to go. So Fudge, 98%. Fudge, I think you've fallen out of love with me. How can you love me 98? What about the remaining two? What did you Okay, so we need to go. And I want to say, Dr. Che, what is your closing remark? What's your closing statement?
Thank you everyone for listening. Happy again to meet you all. I love you all, and I hope you've listened, and I hope you believe in everything we've said. We are here to help. We are ready to help. We are
Fantastic.
here to create awareness.
Fantastic.
Please, I'm going to leave you tonight with one thing, which is care. Do you have anyone going through or suffering or having dementia? Care for them,
Oh,
love them, give them
mm,
everything you can give.
mm,
Thank you so much. God
mm.
bless you. Remain healthy, remain happy, and remain prayerful. Thank
Oh.
you.
Dr. Che, you didn't talk about in our mind
In our mind, it's
is in my mind.
it is
So
in my mind. Sorry, I'm actually a very new member. Um, those words will just stick in
you're
here very
actually
soon.
a true family member.
Exactly,
I agree. So
exactly.
we forgive you for that. Yes, like Dr. Uche said, we have not finished the talk on dementia. No. However, what we want to say tonight, please, all your questions, if you have any suspicion, you think someone, I'll mute you, Dr. Uche, you think someone has dementia or they are behaving strange out of their normal regular behavior or they cannot do the activity they usually do previously, please, hello, don't start thinking, don't self-diagnose. Can you take them to the hospital? Why I'm asking to take them to the hospital is because the doctor, we have a plan with you as well, telling you what kind, because we've not talked about the forms of dementia or causes of dementia. So they will tell you what kind of dementia it is, what caused it, and what is the maintenance. Like you are asking, is it curable? Someone said dementia is not witchcraft. Thank you, Oluwakemi. So you don't want to just self-diagnose at home. Please don't do it. I beg you, in the name of God, don't do it. Or in the name of what you believe in, don't do it at all. Please, I want to beg you, go to hospital. They will diagnose, they will check. It may not even be dementia. But if it's, for instance, dementia, they will be able to tell you what kind of dementia, what form, what is the likely causes, and what you will do to prevent it from progressing. If you don't go, you just think and you leave them there, you self-diagnose, it progresses. Please, go to hospital. Go to hospital. Let them tell you what it is and tell you how to manage it so it will slow down the progression. They can live up to 20 years if it's well managed. But if it's not well managed, anything that hits it can kill them. Please, I beg you, go to hospital. We'll come back again. I think we'll look at causes of dementia, forms of dementia, and carer stress. We asked you how you feel caring for dementia. It's not easy. It's not easy. So we also look at how we manage you as well. So thank you very much. In our mind, it's always in my mind. And your destiny is in your hands. Go to the hospital, BP, DM, and cholesterol. BP, blood pressure, BM, blood sugar measure, and cholesterol. Have it checked. Come back to the page. We'll play a game for 150,000 naira from Dr. Uche or more. Thank you very much. Bye bye. I love you. Love you.